I'm a specialist small animal surgeon, which means that I'm qualified to do any type of surgery on small animals. That qualification allows me to call myself a specialist, but it doesn't specifically allow me to do those types of surgery. Anybody can do a surgery on a pet as long as they have informed consent from the owners. So as far as how many patients we treat on an average week, we probably do something like 25 major surgeries. We might do about 25 or 30 CT scans, maybe 15 or 20 radiation treatments, and in general about maybe 60% of them are for cancer. Pets certainly have become part of the family in the last few years, and certainly with couples whose kids have gone off to uni and moved out and that sort of thing, the household pet becomes absolutely a member of the family, and they're happy to do whatever it takes in many cases in order to provide treatment, as long as it's rational and practical. People are happy to do often whatever it takes. There are a couple of different issues that have led to people spending more money on their pets. Number one, I think that disposable income in Australia is still pretty available. The other is the availability of the technology that specialists have to offer to pets. And the other thing is that the pet has made the journey over the last few decades from the back garden into the living room, into the bedroom, and even up on the bed in a lot of cases. Equipment that's very advanced, or that was very advanced in humans maybe 10 years ago, now is being replaced by even more advanced equipment, and so that allows vets to purchase those pieces of equipment secondhand for costs that are not prohibitive. For example, our CT scan would have cost $500,000 new, but we got it just a couple of years old for $120,000. In regards to what people are willing to pay for different types of treatments, a lot of it depends on value for money. If we can provide some improvement in survival or prolongation of quality of life, people are happy to spend actually quite a bit of money, be it $4,000 for a knee reconstruction, or $5,000 for a spinal surgery, or even $10,000 for a combination of surgery, radiation therapy, and chemotherapy in some cases. The question of health insurance comes up frequently, and in fact there are probably 10 different companies in Australia that provide health insurance for pets. And what happens is that you pay a monthly premium of $25 or $35, and then that provides coverage for almost anything that might come up. And so, some of them will have a maximum of $15,000 a year or whatever, which covers pretty much anything that might eventuate. And so more and more of our clients have pet insurance, which basically takes the financial concerns out of the picture.